Thank you, and thank you, Jane. You can read this in when you listen to the cricket in the garden. We've got the slides too, so you can get through them really quickly. And that's just what I'm going to do for you, because we want some Q&A, and then we can all go on to the rest of our days. But it was an absolute delight, actually, to be asked to do this. And as Richard says, it does build on some of our previous work, particularly those who are aware of our work. The piece of work we brought together in a similar way, in a way, for local authorities as they took up their returning public health ambitions. We tried to bring a lot of the information evidence together in a way that is easier to consume. So very much we have a huge debt to academic evidence in this report and in our previous work, but we're trying to make it much more accessible, much more usable, much more practical. And our contribution on that is the paper that you have here. And again, it'll be sort of freely downloadable, etc., from our website and the NGS's website as a blog too. But it has 4 main aims to contribute to the understanding, assessment and development of the links between gardens, gardening and health. To set out the evidence base, and I think, as Jane says, it's the amazing, there is a huge amount of evidence here, and we've tried to bring it together. It's not all randomised control trial evidence, but I don't think that is actually, as Jane says, actually necessarily the appropriate type of evidence in this field, although it can always help. I think what we've done here is bring the evidence together across the life course too, trying to, from early years, child health, child gardening, etc., gardens in schools, all the way through to independence, as we old, falls prevention, etc. So we've tried to bring it together into one place, or at least the links into one place. And critically, at the many points in the health and care system that gardens and gardening can make a strong contribution to keeping us well and independent. So trying to bring one set of information together into the health and care system. And we set out a menu of recommendations. It's very much a menu because we recognise not all of them will be taken up, not all of them will be appropriate at this time, and not all of them are appropriate for everybody who has a link in between gardens and health. But we set out some of our ideas at a strategic, local and evidence level around where we can do that. And that's essentially what the report is. This was something that we put together right at the beginning of our work, thinking this might be a way to draw such a simple diagram, to draw some of the many links, the diverse links between gardens, gardening and health together. And when we say gardens, when we think about it, they're large to small, they're private to public, and all many forms in between. It's about access to gardens. Some of that's free, some of that's fee paying. The NGS is a fantastic example where you pay £3 or £4 or £5 to go and see a wonderful private garden. All that money is then channeled back into the NGS's health charities. There are various forms of ownership, individual to group ownership, and of stewardship and maintenance. And the role of volunteers is really, really important here, I think. And we've done quite a lot of work here on volunteering as well, and volunteering in health, how volunteering can improve your health, but also support the health and care system. So gardens, actually, when we think about it, have very, very many and diverse forms, but also the impact of gardens, very, very diverse. I won't go into great detail here, but you can see it in the report. But in improving our physical health, yes, but also our mental health, our resilience, our sense of solace that we all feel when we have the opportunity to be in a garden. So physical, mental health, recovery and resilience. And the report talks about that, the evidence for those things in detail, although not too much detail, you'll be glad to know. I just want to say quickly, astonishes me the scale and reach of gardens. I use this phrase, but I'll stop from using this phrase, but I'm going to use it now. So it's the elephant outside the room. Half of an average city's green space is private gardens, and half of adults report gardening as a free time activity. That's immense. That's 25 million of us. Around, and this is just a trend, so gardening is on the up a little bit. That's not a sort of huge trend there, but half of us garden. What an amazing asset we have in our gardens. And gardening critically becomes more important to us in terms of identity and source of physical activity, stimulation and contact as we age. If you look at some of the government survey work, gardening is important across the life course, but it is, as other things in terms of physical activity in particular fall away as we age, gardening is there and becomes much more important, in terms of its impacts on reducing social isolation and keeping us independent. As Jane was saying, there's some emerging evidence about falls prevention and balance and gait. But I think one of the key things that came out for me from the report was the impact on our mental health. That comes across from all the work on green space, of which gardening is one part. And we have some representatives here, so please talk to them from Thrive, etc., and other mental health related charities. I've already said that what we try, and the message today I gave from me is not to go into detail, but to say in the report you will find, when you get time to digest it, trying to bring together where gardening connects and visiting gardens too, across the life course, at school, as families, the use of allotments and the evidence there around how important that can be, and as we age. And there is also some emerging evidence around cognitive decline, but the evidence is emerging. But also to be aware that actually sometimes gardens can be burdens. And again, anecdote, N=1, my mother was a keen gardener. As she became less independent, the garden became a burden. So there are some fantastic schemes, and I think we should really support these around the reciprocity of working in gardens, where many young people can't afford a garden today, particularly in cities like this one. And we have elderly people with gardens that they can no longer work in, which causes them a lot of mental anxiety. So there are some really interesting schemes where we can bring younger people across the generations and older people together. Why can't we help support younger people garden either for food or for pleasure, and also creates reduce socialisation amongst the elderly? That's, again, as James was saying, that doesn't cost money. What the statutory services can do is try to help that happen and support that happening. And there are some really good examples of that around the country. Some of those are in the report. And finally, gardens have, beyond the individual, gardens have important roles in public health in terms of their effects on climate change, pollution offsetting, and as part of wider green space flood risk. So there are environmental benefits too from having well-tended and good gardens, which reduce population health risks indirectly. There are some really important entry points, in the report, we talk about 4 key areas. Now, there are many more, but we had to keep to 4, where we think gardening and gardens, there's some really great examples. I'm very pleased that Ed Rosen and his colleague are here today from Lambeth GP Food Co-op. I'm sure Sam will talk more in Q&A also about the role of social prescribing. The Lambeth GP Food Co-op is a fantastic example. In 11 practices around Lambeth, the co-op has created gardens for people with mental health problems, maybe recovery from alcohol and drug problems, to give them very positive experiences. They grow food, they work together, they reduce social isolation, and now, brilliantly, they're selling their produce into King's College Hospital. So we've got patients being prescribed gardening as a health intervention, then growing food, feeding other NHS patients. That's a wonderful virtuous circle. So the more of that we can have, the better. And Ed is here today. Another entry point is in terms of recovery from serious illness, serious problems. And we have Olivia from Horatio's Garden here today as well, where there are wonderful gardens being set up alongside spinal injury rehabilitation centres across the country. So that's another way where gardens can be really, really important. We also, our own work from a couple of years ago, we did a lot of work on enhancing the healing environment, and we supported both case studies of garden design, acute and mental health care settings. And so we have these are all available on our website. Again, I'm not expecting to read all of this, but lots of really amazing examples where the NHS is investing in gardens and including hospices. And this is a quote that I thought was really, really powerful for me. It's from Sarah Waller, who used to work here, is now at the Association for Dementia Studies at University of Worcester. And she said to me just over the phone talking about this, when we were working with the prisons, it always struck me that prisoners have a right to a period of time in the open air each day, but we don't, as an NHS or social care system, make sure our patients or residents have the same privileges. I remember meeting a service user who had not left a mental health ward for over 6 months until the day we opened a garden in Sussex. Isn't that really powerful? A testament to, we give prisoners, as we should do, rights to being outdoors. I'm sure they're not perfect gardens, but we know that actually some prisons do support gardening as an activity, but we don't seem to give our own patients similar rights. We finished the report with a menu of recommendations, as I say, and I'm not going to go into detail here. There are lots of acronyms on this slide, which many of you will not necessarily understand. But what we try and set out is we think there's a real case here, and again, great that Jane has supported this and feels the same way. At strategic policy level, we're now moving into a system which is fantastically focusing more on people and populations and place. Now, you could say, well, it's obvious that health policy should move in that direction. Yes, it is, but we have been so focused on organisations in particular, I think, over the last sort of, well, however many years. So we very much welcome here at the fund, and as Rich was saying, we're moving this direction ourselves on people in place. Gardens are all about people in places. So some of our recommendations about how do we create the environment for some really strong strategic links between gardens, gardening and health at strategic policy level, be that at the level of departments, DH, DEFRA, community and local government are critical in this, be that in supporting those programmes underpinning the 5-year forward view. And it's great that Healthy New Towns in particular, I think representatives are here today, but also some of the other programmes in the 5-year forward view. The Models of Care programme, the Social Movement for Health programme, the Realising the Value programme, all very, very connected into what gardens can contribute. And also in terms of planning healthy weight environments and the role of local authorities. And as I've also said, also the contribution of volunteering and social action. We then also present recommendations locally. And finally, you'll be glad to know we do talk about the evidence, but it's not just about more evidence is needed. We think there is more than enough evidence to go on here. Yes, we would love some more RCTs to look at the specific mechanisms perhaps, and the RHS has been funding some of those, which is great. But actually the priority should be how do we get the existing stuff we've got, which we refer to in our report and elsewhere, into practice, into action, because we've got more than enough to go on. What we need to do is really create that social movement for this within the system. So to conclude, I think what our report demonstrates, shows, and sort of like shows that the common sense is right. Gardens and gardening are important to us, particularly across the life course and increasingly as we age, but not just as we're older. It influences health in complex and multiple ways, and I think the weight of evidence and health is really convincing despite a lack of RCTs. RCTs are not set up to measure one intervention, multiple different types of impact. So they're not necessarily a huge suite of RCTs is not what we're calling for, you'd be glad to know. More and better quality evidence is always good, but we have enough to act. We think there are excellent examples where the health and care system is already integrating gardens and health, from social prescribing to dementia gardens. I haven't really talked about dementia gardens here, but that's one of the most moving parts of the research that we did. Some of the incredible stories around dementia, and I think it's also interesting how gardens don't need to be beautiful. Some of the best dementia gardens are scrubby, not particularly beautiful places, but they're places where people can connect with their past lives and can weed. Having a beautiful garden isn't great for a dementia garden because there's less activity. Having a beautiful garden for some forms of recovery is great. So actually, the right garden for the right circumstance, I think, is one lesson that came out for me in thinking that through. And finally, health policy and practice needs to see gardens and gardening as part of the mainstream, contributing to existing strategic aims, not new ones, and local needs, and not seen as an exception. So I hope you enjoy the report when you take it away, and very happy we're going to go to Q&A. So thank you very much.